Welcome to the Champions of Active Women podcast. In each episode, we share stories and experiences of active female role models and individuals who support the active pursuits of girls and women. Our goal is to encourage and inspire girls and women to be active for a lifetime, to reach their goals, and to break new barriers in sport and life. This podcast is brought to you by the Active Women's Health Initiative in the Sports Medicine Research Institute at the University of Kentucky. The mission of the Active Women's Health Initiative is to optimize health and promote physical activity and wellness for girls and women across the lifespan. If you enjoy this podcast, you can make a donation to the Active Women's Health Initiative at uky.networkforgood.com. Your contribution helps us empower all girls and women to find their inner athlete and become athletes for life. Dr. Christa Hendley has been part of the staff at Transylvania University as an assistant athletic trainer since November 2017. She has over 10 years of experience in athletic training within high school and collegiate athletics. She completed her Doctor of Athletic Training degree in May 2020 from the University of Idaho, holds a Master of Science in Athletic Training from East Stroudsburg University in Pennsylvania, and a Bachelor of Science in Athletic Training from Colby-Sawyer College in New Hampshire. Dr. Hendley is an adjunct faculty member in the Health and Exercise Science Department at Transylvania, as well as a part-time professor in the Master of Science Athletic Training program at the University of Kentucky. Her research interests include using diaphragm activation to treat acute, non-specific low back pain, which was a topic accepted for presentation at the Southeast Athletic Trainers Association in March 2020. In her spare time, she enjoys spending time outside hiking with her dog, Leila. So Christa, thank you for joining me today via Zoom.
Hi, Dee. Thanks for having me. I'm really excited.
So you are currently working as an athletic trainer at Transylvania University, and I was wondering if you could get us started by just talking about how you found this career.
So, kind of like a lot of athletic trainers, I sustained an injury when I was in high school. I tore my ACL and my meniscus when I was playing soccer. And not to take away anything from the athletic training staff at my high school, but I went to a very large high school. It was about 3,500 people. And so there were only 2 athletic trainers for that whole population. And so I kind of slipped through the cracks, fell under the radar a little bit because we also had an enormous football team. And so while I worked with really excellent physical therapists, I lacked that sports-specific athletic training piece of the puzzle. And I never really felt the same afterwards. And so when I was a senior in high school and I was mulling over, did I want to become a physical therapist or did I want to go into athletic training? There was an athletic training class at my high school, which is actually becoming more popular. And so I took that class and I just fell in love with it. And that's how I decided to pursue athletic training. And then all 3 of my degrees ended up being athletic training specifically because I just love it so much.
So you had this personal experience that was then combined with some gaining of knowledge through a class and just fell in love for forever.
Yep, there's a lot of ups and downs with the profession, but one thing that has endured is my passion for it, and it just gets stronger. I've been in the profession for 10 years now, and I don't love it any less than when I started.
That's awesome. So what is something about being an athletic trainer that I or our audience might be surprised to know?
The biggest thing that I would want people to know that they might not is that our scope of knowledge is very broad and we can treat anybody that is physically active. It can be a collegiate or high school athlete. It can be a person that works in a factory. It can be a weekend warrior that likes to play their ball games on the weekend just to sustain their physical activity level. We can treat anyone that moves their body. And having access to any and all populations in terms of athletic training can only help people because we have such a broad scope of knowledge that we can help anyone.
Yeah, and that's something I've learned in the recent years as I've joined the faculty here at UK is that there are lots of places where athletic trainers are working beyond the athletic field. So I think that's a really cool aspect of the profession. So what's the best part about your job?
it's the age-old returning the patient to their chosen activity. It never, ever gets old to take a patient from the time that they are injured. And there are many times that we are there from the moment of injury to releasing them back to their sport. You feel very accomplished yourself as an athletic trainer. They feel this feeling of elation and they're looking to you like, we just did this together. Like I said, I've been doing this for 10 years and it still is amazing. I just had that moment 2 days ago with a men's lacrosse player who I had been working with every single day for about 3 weeks. And he was so anxious to get back to his sport. And the moment that he did, I wasn't there because I was covering another event, but I was talking to him on the phone and I said, I really wish I could be here for this. And he said, I wish you were here too, but you'll see me play at some point. And it's never tiring to see that because these patients that we're working with love what they're doing, especially in the Division III setting. They're doing it purely because they love it. And so they have this internal motivation to return to what they love, to what is most likely an arena that is a stress relief for them. It's their area where they're free from all the other ties that bind them. And so to be a part of the process to get them back to that is extremely rewarding.
It sounds like those moments just hook you in the profession for the long term.
Yep. They make all the long hours, all the odd hours, worth it.
Yeah.
They really do. It sounds so cliche, but that's what athletic training is at its foundation, is helping people.
So then on the flip side, what is the most challenging or frustrating part of your job?
And you'll see this theme across the profession is the work-life balance, especially in the traditional school setting, college, high school, middle school, because of the odd hours of athletics. You're playing at night or practicing early in the morning, or you're on weekends. We play on holidays. It can be a struggle to balance, especially those with family. And this is a very important topic in research that many people conduct is a lot of surveys about work-life balance, especially for women, because a lot of people want to have their families and they want to be married, but there's also a commitment to our profession that we have where we want to be there, but we want to be with our families as well. And so how do we balance that? How do we provide the care that we want to provide and be present for the activities that we want to be present for while also being present with our families? And so this is an enduring theme and an enduring struggle that athletic trainers are encountering constantly, is trying to balance that.
Yeah, there is no normal schedule for athletics and then athletic trainers who work in that environment as well.
Even in the industrial setting, you might show up to work at 4:30 in the morning and be done by 1, but then that's it in itself an odd schedule. So really, unless you're sort of working in a clinic with a physician, there is no normal. It's like the abnormal is the normal.
Is normal, yeah. So going back a little farther than high school, can you talk about your sport and physical activity experiences as a child?
So one of my earliest memories is running on the track with my mom. She took my brother and I everywhere with her, like she even took us to work. And one of my first memories is running on the track with her because she has always been physically active and I have always been physically active. We just have this desire in our bodies to move. And she has really influenced me to be active from the time that I could remember. And she put me in a lot of activities to keep me occupied. And so I started playing soccer when I was 5. I tried track, I tried cheerleading, I tried lacrosse, which became one of my favorite sports. And my mom was always pushing me to try new things. When I find something that I am good at, that's what I want to stick with. Why would I want to try something that I might not be good at when I'm good at this one sport, which was soccer at the time? And my mom forced me to go try lacrosse, and I didn't want to go. I knew I wasn't going to be great at it. I had never played it before. And it was the best thing that she ever made me do because I fell in love with it instantly. And so she's really been the driving force behind my interest in physical activity. Beyond sports, we go hiking together, we go skiing together, we walk the trails by our house together. We're always liking to be outside. There's something about being outdoors. There's actually a book that Dr. Sharon Brown loves to give our students at Transy. It's called The Nature Fix. And there's just something about being outdoors. And so I just love to be outside and moving. Even now I'm away from my mom. She's in New Hampshire. I hike with my dog, and my dog's a great hiking buddy. So I really have basically done the spectrum of sport and activity, and I just love doing it. It's more like a lifestyle than anything else.
It's awesome that you had that early role model that really is carried through your whole life and set you up for a lifelong life of activity. So what did you love about playing sports? You mentioned really loving lacrosse and soccer. What did you love about playing sports?
So as I've gotten older, I've realized that I'm a very internally motivated person. I don't seek to compete with others. That doesn't really interest me. I seek to compete with myself. Even in a team sport, I've always wanted to just be the best version of myself. So growing up, I could always be found in my yard with my soccer ball, juggling, kicking it against the house. Same thing when I picked up a lacrosse stick. I wanted to be the best player that I could be. So my parents would find me until it was dark out, throwing the lacrosse ball against the fireplace. And that's what I loved about it, is I was constantly challenging myself, and I was surrounded by players that were challenging me to be better as well. And so by being with people that were better than me, I rose to their level, and I was able to watch them and model them, but also cultivate the things that I was good at as well. And so still to this day, when I exercise, I compete with myself. You know, if I'm kickboxing, how much longer can I go without having to take a break? If I'm working on core or strength training, what's my weight today? How many reps did I get done? So I compete with myself, but then I also enjoy the friendly competition with others.
So you've been in sports from the time you're young all the way through today and now in your career, and sports are often a male dominated arena, for lack of a better word. What challenges do you see, either from your own experiences or from colleagues, for women in athletic training specifically?
I think that the upward mobility into spaces that we might not have occupied previously is the barrier that I see the most. And those barriers are being broken down every single day as we move forward. It's been incredible. The Dodgers hired their first head female athletic trainer, and to see that go on, and Transy is actually a shining example of having women in administrative positions. I haven't seen anything like this at any other school that I've been at. And so really having females in positions of power where we have not been before is something that I would like to see more of, but we're definitely moving in that direction because female voices are valuable voices. We have experiences that other people might not have. We have perspectives that other people might not have. And our voices are valuable. And so that's what I would like to see is women in power in athletics.
So in your role, you're working with student athletes, and as a woman in athletic training, you are serving as a role model for probably other women or other people who are kind of looking to that career. What do you hope that people will see in you as they look to you as a role model?
The one thing that I have learned to embrace just in the last couple of years is vulnerability. And that comes from the woman herself, Brene Brown.
I was going to say, you must be going to reference her.
Yes, I absolutely love. I've read Daring Greatly. I'm currently reading Dare to Lead. I follow her on Instagram. I just think she's fantastic. Actually, a former female administrator at Transylvania introduced her to me. Her name's Mary Struckoff. And that was probably the best thing she could have done, is hand me that book and say, Christa, you should read this. And ever since then, that was a couple of years ago, I have tried to embrace that theme, that vulnerability is a strength. And that vulnerability actually lifts people up around you and makes them feel safe. And I think that it's really important to not only show what you're good at and situations in which your knowledge is really important, but also to admit when you're wrong and when you don't know, because that is something that people struggle with. And I think when they see people that are helping them admit that, okay, this treatment isn't working, this rehab isn't working, let's pivot and go in another direction. That resonates with people, I think, more than we realize. And showing them that we're human and that we make mistakes and that we can change and be flexible, I think is very powerful. And so I try to model that. I try to show my patients who I am as a person. We spend a lot of time together. I really enjoy manual therapy. And so I spend a lot of hands-on time with my patients where all we can do is sit there and talk. And so I try to learn about them and what motivates them, but I also like to give them insight into who I am as well, who I am outside of the athletic training facility. And we connect really nicely on that. And so that's what I try to role model, is that we are all just people and we're here to uplift each other.
So then who are you looking to as your role models?
Well, for me personally, first and foremost, Jesus is my model. I don't try to reflect anyone other than him. And for me, that is the biggest compliment anyone can give me, is if they see him in me. And then everyone else in my life has characteristics that I would like to try to model. Both my coworkers have characteristics that I appreciate and respect and that I try to use. My friends all have characteristics that I would like to reflect. I have had really amazing mentors in my life. The head athletic trainer at the University of the Cumberlands really mentored me for the few years that I was there. And I've taken with me a lot of what she taught me and showed me about how to be a good clinician, but also a good coworker. I look to my family. My mother and my brother are very, very different than me. And I try to appreciate those characteristics that are different, because it reminds me that there is always a different approach to situations in life beyond what kind of my knee-jerk reaction is. So essentially, I try to surround myself with people that aren't exactly like me, so that I can watch them and learn from them. But I'm also a huge reader. I'm sure you've picked that up by now. So people like Brene Brown, Mark Manson, I teach out of his book, Malcolm Gladwell. Their voices are so meaningful because you can connect with what they're saying, because they speak to you and they write to you on a deeply personal level. And so everything that I'm reading, I'm absorbing and I'm trying to characterize within myself.
Well, it sounds like a lot of self-reflection and really like embracing that process of continual improvement that you are using the others around you and things you're reading to really be the best version of you can be.
And that was one of the main kind of tropes of the doctorate that I achieved almost a year ago. It was a doctor of athletic training out of the University of Idaho. And there was a deep amount of self-reflection within that program. And I had never really done that before. I'm a very pensive person naturally. I spend a lot of time with my own thoughts, kind of weeding through things. But the DAT program taught me to take those pensive moments and put them in a direction and make it more of a mindful self-reflection. And so that is a skill that I have honed over the last 3 years or so that has really aided me in many areas of life.
So speaking of research, I know that was part of your DAT program. And if you think about that in your clinical experiences, what do you think our listeners should know specifically about injury prevention and or treatment for girls and women?
Which is an interesting question, because athletic training has really moved from a reactive profession to embracing the proactive. By nature, we are present for a lot of injuries and we're reacting to those. But now I think the profession has been around for a long enough period of time, and there's enough research foundation to really show us, okay, these are the injuries that are occurring in certain populations, and this is how we can prevent them. And specifically with girls and women, I kind of like to take a multi-prong approach to that question in terms of training, in terms of rehabilitation, and in terms of kind of building strength and prevention of injury over a lifetime. And so the first thing that you'll hear just in general is to not specialize kids in sport. Having them in different sports that have different functional movements can only aid them in preventing overuse injuries as well as acute injuries, because their systems are so overworked that acute injuries occur when normally they might not. And then the other prong that I like to take an approach from is training in a translational manner. And I've really embraced that notion from a strength and conditioning specialist out at Texas Christian University. His name is Zach DeCant, and I follow him on Instagram. And he is all about training athletes how they're going to play their sport. So if you have a women's soccer player, incorporating rotation into their training, incorporating all of the functional movements that they are going to play in your training and in your rehabilitation. So don't just do squats, don't just do lunges, don't just do like dead bugs on the table because you think that's going to build strength. It should, well, that's a good place to start. You want to make it translational to what they're doing. And then a kind of a second layer to that is training patients in multi-planar movements. And so what I mean by that is many people are forward moving in their sport or their activity. And that might lead to weakness moving side to side or moving through rotation. And so making sure that we are training these patients through all their planes of movement to develop strength in kind of a 3D model will also prevent injury, because you might have strong hip flexors and hamstrings, but you might have weaker glutes and external rotator muscles. And we need all of those muscles to stabilize us. We need a good core while we also need good leg muscles. So taking that perspective, I have found is really important, and training them through their functional movements. It takes practice over and over and over again, but you'll see the results. I was able, before the pandemic started, I was able to work with our women's soccer and women's lacrosse team in an ACL prevention program. I had done a bunch of research about what programs were statistically proven to decrease ACL injuries. And so I found a program, I watched a lot of videos, I read a lot of articles, and then I was able to get these two teams on board. It takes about 20 minutes before their practice, and essentially it's supposed to become their warm-up.
Mm-hmm.
And it's a lot of jump training, it's a lot of agilities and learning how to properly change direction. And I noticed after about 3 weeks, their functional movement started to improve.
Mm-hmm.
And it was really rewarding to see that happen, because there's a lot of talk about prevention, but not a lot of clinical athletic trainers know how effective that is, because we're not buried in that research. It hasn't really reached that clinical level yet. And so to see the fruits of that labor was pretty awesome before the pandemic started. And so being exposed to that just kind of lit that fire to start it up again once we get past this weird time.
Yeah. So how did the athletes react to that kind of program?
They embraced it, actually. It took some practice. I had to be out there cueing them constantly, which athletes don't really enjoy. They kind of just want to get it done and get to the good parts of practice.
Mm-hmm.
But then when they started getting better and they started getting the really good feedback, they just started doing it on their own. If I was running behind in the athletic training facility and they needed to start, they would just start, and they would know how to get themselves through it and to do it right. And so to teach patients how to do something correctly is really awesome, because like I said, they just want to get it done. But usually when you're in that mindset, you're not doing things right. And so to slow them down and take them through the process was rewarding, because they embraced it as well.
And that's good for sustainability, right? Because if they don't want to do it, it's a whole lot harder for you to get them to do it well.
And now their warm up looks a lot like their prevention program. So that was really cool.
And that's a great way to make long-term changes, right? To get something that can be integrated into actual training protocols. So thinking, you've talked a lot about kind of holistic health and just thinking about athletic training really broadly. And one of the things that I've learned over the past couple of years is that the field of athletic training is moving towards thinking about, like you said, prevention, long-term health, not just about high-level athletic performance, although that's certainly part of it. So I'm wondering if you could speak to what kind of messages you hope your athletes have about long-term health and engagement in physical activity.
The message that I try to give them, especially now that I'm teaching health and wellness at Transylvania, is that wellness is multidimensional. Okay. And so if you want to get through your full season that might be 5 or 6 months long, and you want to do that and be injury free and feel healthy the whole time, there are multiple perspectives that you need to be looking at. You need to be getting a good amount of sleep. You need to be managing your stress levels. You need to have good nutrition. You need to have good physical wellness. There's so many dimensions: spiritual wellness, social wellness, financial wellness. And especially in Division III athletics, we see students that are affected by all of these dimensions at any given time. They have so many things going on in their life, between their friends, their romantic relationships, their familial relationships, as well as school and sports. They're trying to juggle all of these balls, and it can be hard to keep them in the air without dropping one. And so I think that it has become a really important part of an athletic trainer's job to remind them what dimensions of wellness they should also remember to pay attention to. And I think that that's the way to keep them healthy, is to recognize when they might be struggling with their mental health, and when they might need a referral, when they might need some guidance about what is proper nutrition for their sport, and when they might be burning the candle at both ends, and discussing, how to manage their time. Time management is a skill that takes a lot of practice. And so we work with these athletes on all of these things. And so when they're looking at all of these dimensions, we're seeing far less injury, illness, and just like complaints overall of body soreness, because they have looked at their whole picture of their health.
So I love that holistic perspective, and I think it really is a big job that's put on athletic trainers and all the people who surround athletes, but I think an important job to keep them healthy for the long haul. So shifting gears to your own health, I know from my time as an athlete and as a coach, and you mentioned earlier that the work-life balance is crazy. So how do you keep yourself healthy and take care of yourself so you can help take care of the athletes?
This is something that I work on constantly. It's not something I don't think that you ever become good at, because athletic training is just constantly so fluid. And so I really have a lot of respect for our head athletic trainer at Transy. He manages our schedules, and that's a lot to juggle. There's a lot of events and practices going on, and he tries as hard as he can to give us one day off a week, which can be very challenging. And I'm a planner. I have an agenda book that I write in every single day. And I try to manage my time that's to myself as efficiently as possible, while also giving myself the rest that I need. And so sometimes that means saying no to going out with friends, but sometimes that means spending quality time with those friends, because I'm an extrovert. So if I'm left alone for too long, I kind of like shrivel and die. But if I'm out with people all the time, I'm kind of wired, and I'm so upregulated that I can't come down. And so I have to try to listen to my body. I've tried to take a more intuitive approach to how I'm feeling and what is best for me. Sometimes moving my body is exactly what I need. Sometimes it's coming home and snuggling on the couch with my dog. Sometimes it's going and being with friends. And so I try to every day just assess how I'm feeling and respond to what my body is telling me. And that, I have found, is the best way to manage my personal work-life balance. This pandemic has thrown athletics into this tornado of uncertainty. Sometimes we're working a ton, 13, 14 hours a day, and sometimes we're not working a ton. And so taking my downtime when I have it and reserving my energy for those busy days has really helped, because prioritizing my needs was never something that I did when I was younger, because I just wanted to help people. I said yes to everything. And now I know when it's appropriate to say, they do not need me right now. They're okay without me. I'm going to take this personal time. Or this is something that's really important to them. They need my presence there. So the decision making as I've gotten older has become easier, but I also reach out to people too. There are a lot of people, especially at Transy, that I feel comfortable going to and saying, this is what I'm dealing with. What are your thoughts? This is the situation that I'm looking at. What are you thinking? And then I just do what I will with that information. And so having a network of people to be able to reach out to, be vulnerable with, and say, this is what I'm dealing with right now. Can you give me your guidance? And then also prioritizing myself.
So it sounds like some time in your career, as well as getting to know yourself and your own needs better, has really helped you to manage, and that it's a work in progress, like all of us.
And it can catch you when you're not aware, because like I said, we are a very helpful profession. So you'll find the people in athletic training just want to help people. And for me, when I'm feeling burnt out, my cardinal sign is apathy, because I'm a very empathetic person. And so when I feel apathetic, I know that I need to prioritize my rest when I'm not at work. And so that's what I mean by that intuition with my own self, is recognizing how I'm feeling physically, emotionally, spiritually, mentally, and making my decisions from that perspective.
So as a final question, what advice would you give to girls and women about playing sports, being active, or maybe even entering sports related careers?
So there's a couple of things that come to mind. And the first is, and this is something my mother taught me, is do what you're passionate about. Do not spend your life doing things that you don't want to be doing. Love what you do, and you will feel more fulfilled than you could possibly imagine if you're spending time doing what you enjoy. And it can take some time to figure that out. And that can be in terms of your profession, in terms of your physical activity. An example for me, I don't like running. I don't like it. But everyone talks about running, right? Everyone talks about running half marathons and triathlons. And that's fantastic. That is a huge accomplishment that people achieve, but that's not my cup of tea. So I spend my time doing HIIT training and kickboxing, and I hike mountains, and I like to kayak. So I have found physical activity that I enjoy, and I'm not going to spend time doing something that I don't like. The other message, and I really want to get this across, and I teach this in my health and wellness class, and this is becoming an important topic, especially for women. And that message is that fit and fat are not mutually exclusive. There is this body image, especially in athletics, that society has really pushed on us as women that we need to look like. And athletics is such a broad spectrum of what women look like. And just because of what you see does not reflect someone's health. And I feel like a lot of women and girls, especially women that carry a lot of muscle and are very powerful and are very strong, they go to the doctor and they're told that their BMI is too high and that they're obese. And then they carry around this label that they're obese when they are just built differently than what society thinks that we should be built like. And so that is something that I really try to discuss with female athletes in particular, because athletics by nature builds you to be like that sport. And women have so many body image issues because of the expectations that have been put on us. And so I just want women to understand that no matter what you look like, you're capable, you're beautiful, and you're strong.
What a powerful message. Is there anything else that you'd like to leave our audience with today? Any other things we didn't touch on that you'd like to share?
Nothing that I can think of. I just want people to live the life that they want to live. Do what makes you happy, and you will be more fulfilled than you could ever imagine.
Well, thank you so much for sharing your insights on athletic training and being active and living a well-balanced and healthy life today.
Thank you for having me. I had a good time.
Thank you for listening to the Champions of Active Women podcast. This podcast is brought to you by the Active Women's Health Initiative and the Sports Medicine Research Institute within the College of Health Sciences at the University of Kentucky. This episode was produced by the Faculty Media Depot. If you enjoyed this episode, please subscribe, share with your social networks, or simply tell a friend about us. If you want to help us sustain the Champions of Active Women podcast, donate to the Active Women's Health Initiative at uky.networkforgood.com. For up-to-date information about our initiative, follow us on social media at UKAWHI. Thank you for joining us as we empower all girls and women to become athletes for life.